Now, we know the last 2 years have put the NHS under pressure like never before. We brought you the stories on this programme of exhausted medical staff and patients having long waits for treatment. Well, it seems like an increasing number of people are willing to shell out their own cash to get the treatment they need earlier.
Yeah, new figures show the number of patients in Scotland opting to pay for operations, including cataract surgery and hip and knee replacements, increased by 84% in the last 3 months of 2021. Across the UK, so-called self-pay procedures in the same period went up by 39%. But in terms of baseline numbers, people in Scotland are still less likely to be opting to go private than in the UK as a whole. So where do you come down on these statistics then, and especially in relation to Scotland, where there does seem to be comparatively a very high increase, 84% in the people that are choosing to go private, as opposed to across the UK where it's 39%?
So I had a very quick look at the statistics literally about 10 or 15 minutes ago, and was looking at the overall numbers of people in the UK in 2019 who opted for private treatment across the UK was about 50,000. So if you were expecting Scotland in percentage terms to be represented within that figure, it would probably be around 5,000, but it was nearer 2,700. So it was lower than you might expect. And then jumping forward to 2021, 70,000 overall. Again, you might expect around 7,000, but it was nearer 5,000. So although the overall percentage has gone up, I guess Scotland is still less likely overall to have people opting for private treatment, which I think is also important to pull out, because there will be lots of factors driving that. So more people than before are opting for private treatment in Scotland, but it's still less likely if you live in Scotland that you're opting to do that than compared to the whole of the UK.